In the show, we discuss the latest advancements in breast cancer research and treatment as part of Breast Cancer Awareness Month. Now we're turning our attention to a topic that's raising some very important questions: hormone replacement therapy. Joining us more to talk about this, we have Dr. Julie Peck here, breast surgeon at Backus Hospital. Doctor, first of all, thank you so much for your time this morning.
Thank you for having me here.
Thank you. We've been talking a lot about breast cancer, of course, during October, as always. So what should women know about the risks and benefits of hormone replacement therapy when it comes to breast cancer? Can you talk to us about this?
Of course. So I think it's very important to remember that hormone replacement therapy, or we like to call HRT, a little easier to say, is used because women, when they transition through menopause, are having hot flashes, night sweats, mood changes, changes in their sexual desire, and so it helps with quality of life. And there are multiple types of hormone replacement. Some use just estrogen, and some use both estrogen and progesterone, and those are the female hormones. Those that use the progesterone have a very slight increased risk for breast cancer. There was a lot of research that was done in the early 2000s that showed that that risk was present, but with more research, we're seeing that it's about less than 1%.
There's obviously a lot of questions surrounding this. How does age or timing of hormone replacement therapy impact breast cancer risk?
Yes, so the use of hormone replacement therapy, when it started closer to menopause or during that kind of transition point, has less risk, not just with breast cancer, but with other issues like cardiovascular disease, but also the amount of time you use. So using it for more than 5 years, there's research that shows that that starts to increase your risk for breast cancer more. So it's both earlier is better or closer to menopause, and then for less than 5 years if possible.
A lot of people probably wondering more about this. So what is Hartford Healthcare doing to try to educate patients about this hormone replacement therapy and its potential link to breast cancer?
So there's a lot of information out there and a lot of research that's being done as a greater whole in the world. And so Hartford is just helping educate their providers so that they can talk to patients more openly and honest. Every decision at Hartford is a shared decision with the patient. So there's a lot of information out there, and we're trying to solidify what is best for them and then what choices or risks they're willing to take versus the benefits.
Yeah, a lot of people probably wondering if there are any safer alternatives to hormone replacement therapy. Perhaps you're managing menopausal symptoms. So what would your answer to that be?
So I think the first thing to note is that hormone replacement therapy treats all of those symptoms, but all of the other medications available only treat some of them. But they're still medicine, and so there are risks associated with them as well. So it's always a conversation about what is bothering them, and is there just one medicine that we can use to help with maybe hot flashes if they don't have all of the other issues? But there are still risks associated with taking those medicines. So again, it's a shared decision-making process about what is best for the patient and what they're willing to take a chance on, I guess.
Yeah, it's great to know that it's an option and to have the conversation with your doctor. Dr. Julie Peck, I want to thank you so much for your time this morning and talking to us about this. Thank you.
Thank you so much.
Coming up this morning, Gen Z and Gen Alpha influencing the way we talk. We're checking out the top slang words of 2025 and what they really mean. Coming your way next.